Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. It is the 27th of September, 2020. Fall has arrived in Oklahoma City. It's been rather nice out, but windy. So that's okay, I think. A little rain. So what's the COVID update? Well, unfortunately, we've crossed over 1,000 deaths. That's a milestone that I don't think any of us ever wanted to hit. It was projected to hit about 600 deaths by the end of August. I don't think there was ever a prediction or a projection we'd hit 1,000 before September ended. So that's unfortunate. We're averaging about 1,000 cases a day since the 15th of September. The 25th of September, we had 1,276 reported cases. That puts us at our third highest case total for the entire COVID event in terms of a daily total. So lots of people getting COVID. Again, predominantly younger people, at least 25% of them are in, the 18 to 28 group or so. None of them are, or for the most part, very few of them are getting significantly ill. I have not heard of any reports so far from people in the medical community about them getting very, very ill, but they are a source for transmission, unfortunately. So again, since our case numbers continue to rise, our death numbers continue to rise, we need to be careful, and we need to, and I do have some good news about prevention, but we do need to really be careful. I mean, for those of you who don't believe in masks, that's fine. I would always encourage everyone to wear a mask because you may not get it by wearing a mask, or if you have it, you may not spread it. And again, the core things are hand washing, the mask, and social distancing. It really does matter for those people who care and don't believe that it's all made up. Likewise, there's some mutational data coming out that showed that the virus is a little more infective, meaning it's even more infectious than it was. Remember, it's 1,000 times more infectious than SARS-1 was, and now it's getting even more infectious. Now, the good news, if there can be some on that front, it isn't making people sicker, it's just more easily spread. There's been this debate, is it spread by respiratory droplets or not? It's spread by respiratory droplets. Some of these debates are just stupid. I just don't even understand why people are debating this stuff. I mean, it's obvious. The Taiwanese government health ministry showed that it was highly suspicious of it in December, that it was a respiratory spread new viral illness, and then it was confirmed. So why people keep on acting like it's not, I don't know. You can get it from a surface, you can get it through the air, you can get it through direct contact. It's normal for respiratory infections to spread that way. This isn't any different, but the CDC and NIH are always trying to reinvent the wheel to confuse us. That's their job. And on the positive side, though, Dr. Fauci finally said on Saturday that vitamin D is probably preventive. Duh. I mean, think of all the lives that could have been saved if he would have acknowledged that from the clear data before. And reading the people who are commenting on it in one of the news articles, I mean, they're well, we shouldn't check vitamin D on everyone. It could cost money. How much does a COVID illness cost? I mean, it costs hundreds of thousands of dollars if you get critically ill. It's a $45 test. I mean, it's no big deal. And so these are the ranges for vitamin D. Less than 30 is deficient, but that's severely deficient, okay? Over 80 to 100 is optimal, and there's tons and tons of extra benefits when you're there. When you're between 30 and 80, that's the mean, but that isn't the optimal range. So when you're over 80, you lower your risk massively, and I'm giving you data, okay? These are data sets. You lower your risk for heart disease, you lower your risk for neurologic disease, your immune system works, you lower your risk for depression and anxiety, you lower your risk for muscle aches and pains and joint problems and fibromyalgia. There's a myriad of benefits. You lower your risk for heart disease, you lower your risk for a myriad number of cancers, notably breast, colon, ovarian, and I believe pancreatic, if I'm remembering correctly, but I may be off on pancreatic, but I think it's pancreatic. So, and that's just the start. So it's an immune modulator, makes your immune system better. There's been lots and lots of data, and they're finally getting around to admitting it, because God forbid we do anything that wasn't big pharma and a brand name product. And I'm not harping on it. It's just getting so repetitively disgusting. Likewise, 2 journal articles came out in the last week or two, which I will find and post. But again, there's a direct correlation between your zinc level and your infectivity, or your ability to get infected and sick. It's great data. If your zinc level is low, and if it was the average for admission was 43, and that's a low zinc level, you're more likely to get sick with COVID, which is what we've been talking about. If the average for people who got sick and didn't get admitted was 63, so that's kind of getting into a low mid-level. But the whole thing is, if you get your zinc level high, you augment your alpha interferon, so you could get even better results, we believe. Okay, so again, very basic stuff. Vitamin D, 5,000 units a day, depending on your weight, because you're not aiming for 40, you're aiming for 80. So 5,000 depending on your weight. If you're over 125 pounds, it's 5,000 a day. If you're under 125 pounds and are an adult, 5,000 Monday through Friday. Zinc, again, zinc is very, very important. So I did have someone email and said their son got zinc toxicity. I don't know any of the details. Zinc toxicity, it's not toxic if it upsets your stomach. That's just zinc, okay? They didn't get too high of a level. So GI complaints are very normal with zinc. So we've all, any of us who take it, you have to take it with food. I've taken it on a few mornings on an empty stomach. Oh, I haven't done that since probably February. So again, take it, if you're an adult over 130 to 40 pounds, 125 pounds, 50 milligrams a day for about 2 months, and then Monday through Friday after that. If you're under 125 pounds, do 30. It's totally fine. All right. So, and you take it with food, and it's not going to be tragically dangerous for you, because it's not dangerous. It makes your hair grow. It's good for your skin, and it augments your immune system. So we've been using zinc in my practice for forever, but we've been using it for hair growth to stimulate the hair follicle. We weren't using it for immune support. So likewise, iodine, which is in most multis, a few milligrams a day, up to 12.5, is, why do we mention the multivitamin? Well, the compendium of the vitamins in the multi stimulate the immune system, and then there's other substances in multis like iodine, a little bit of zinc, selenium. All those things are immune modulating, and so that's what we want you to be on, and it's really, really important as we start hitting this, because it applies to all flu. Finally, the fish oil, again, to decrease inflammation, is very, very helpful. And then all the add-ons we've talked about over time. The melatonin, again, interrupts the inflammatory cascade, both from the inflammation directly from the pneumonia, but also the bradykinin storm, which is more of an asthma type event in the lungs at the same time that COVID does. So you want to be focused on those things, and we'll be fine. On another positive point, the immune modulatory data of antibodies, the immune effects of the antibody response from getting COVID is becoming clearer and clearer. All the measurements for the vaccines are based on reaching the content of the neutralizing antibodies that are present in the plasma of someone who's gotten hospitalized with COVID. There's been some other data correlating this. They've identified the neutralizing antibody. They've proven it neutralizes the COVID. And so I'll post some papers on that the next day or so. I have them all on my phone. I just have to get to it. And but again, if you've had COVID, you still need to follow all the guidelines, do everything the CDC says. I don't want you to do anything different, but you can rest easy that you're very unlikely to get COVID again anytime in the immediate near future, in the next several months to perhaps the next several years. And eventually then it will mutate a little bit and you'll have some risk. But clearly no one's at risk for reinfection within 3 months, the CDC is saying that. And since they're basing the entire antibody strategy from infected patients and infected recovered patients, you have immunity almost always, okay? So again, we can beat that horse again and again, but I don't understand why we have all this confusion from our science experts, but maybe they're not taking enough vitamin D since it helps with cognition. but I don't know. I think that's about it tonight. I'll keep on posting. If you're in Oklahoma, please be safe. Wisconsin had a huge day today, 2,000 cases. We're over 200, I think 4,000 or 5,000 deaths. India, Brazil, and us are leading the charge of COVID. So we just have to do our best. But everyone's going to start catching up again because the flu season's going to hit, and this is a flu. It's not influenza, but it's still a flu virus. So it's going to ratchet up this winter. And it's pretty much following the pattern of the Spanish flu right now. So we'll just have to watch that and see what happens. Now, I'm not saying it's mutated into a more vicious infection, but just the timing of the waves it's starting to look a lot like what Spanish flu did in terms of timing. So if you get online and go to Google and just put in Spanish flu graft, you can kind of see that it starts going up in October, skyrockets in November, December, but it's pretty much gone by January. And so maybe we'll get lucky and have the same event. That would be really nice. So anyway, that's it for tonight. Take care and be safe.